I think it's incredibly important. Mental health should be treated the same way as physical health. It has the same importance, and definitely in our context, our rescuers are faced with many stressors and potentially traumatic events when they're at sea, with drownings, mass casualties, medical emergencies, and we need to be able to support them. We have a duty of care for our staff to make sure that they're coping with the incidents and feel well supported. So when our crews join, we do an onboarding training for everyone regarding signs and symptoms of stress, that they're able to recognize it in themselves and in their team members. We do trainings on psychological first aid. This normally, because of the population that we deal with, is a tool that we use to be able to respond to people in distress who we rescue, but also it's a good tool for the team to support one another and have resilience within the team. If something potentially stressful or distressing happens, we always have 24/7 on-call psychological support services available for our crew. So psychological first aid is an early trauma intervention approach that we use on board our ship, and we train all of our crew in this response, and essentially it's just a humane, supportive way of responding to someone who's in distress. So it's how we approach someone who's in distress, how we support them, how we listen to what they need, how we make them feel calm, how we comfort them. It's really meant to be not intrusive. We're not asking questions about what happened. The principle is to do no harm and really to follow the cues of what the other person needs. We mainly train our teams to use this approach to respond to the survivors that we rescue in moments when they're distressed, but also we really emphasize that this approach can be used for one another in the team. It's a way to, we all get impacted by the things that we see, and for sure crew are just as susceptible to stress and to distress. Some of the things that we're seeing are quite traumatic. So it's a way that you can support your colleague, and I think by really addressing those distressing feelings in the moment, by making someone feel connected, by making someone feel calm, this helps them cope with the situation, and hopefully also helps them with, in the future, seeing this event as potentially less traumatic. And I think one of the advantages of psychological first aid is really that anyone can be taught to deliver it. So actually it's such a simple approach, and you don't have to be a mental health specialist, but it's really effective, and yeah, it's a good tool that we have.